A specific crisis is sending more children to the emergency room, and the ailment is not always obvious from the outside.
But as Fox 6's Madeline O'Neill found out, some of the reasons behind this declared emergency are becoming more clear.
It's incredibly rewarding when you can make a connection with a patient, when you can make a connection with a family.
It's where worry mixes with hope. Crisis with care.
Yeah, I had a chance to talk with the kiddo.
The emergency room treats all the obvious ailments, from burns to broken bones, and even traumas less visible.
But I will go and talk with social work, and then we can go from there and see what community beds are available.
Psychiatrist Dr. Jennifer Zaspel is on a special team at Children's Wisconsin, along with social worker Allison McCool.
When kids are in crisis and families have nowhere to go, they come to the emergency department.
It's a crisis response team.
We've all known for quite some time that something's going on.
Developed in 2020 to specifically address increasing children's emergencies regarding mental health.
The pandemic kind of like threw gasoline on that fire.
Since 2013, there's been a general upward trend of visits to the emergency department and trauma center for mental and behavioral health crises.
We have a whole kind of spectrum of care that the emergency department, you're right, isn't always the best place to start, but we recognize that we're a safety net, and sometimes that is the easiest place to start.
I don't want to wake up and find my kid dead.
It's a spot Janelle Flintrop knows all too well.
How many times have you taken her to the emergency room for mental health concerns?
So in the last week, 3 times. In the last year, I would probably guess 15 to 20.
She's a proud parent of 3, including 16-year-old Corinne, who loves art and canines.
Most of the time can be pretty much of a jokester. If I would picture her in a classroom, I would say class clown.
Corinne couldn't be here for the interview. She was at a mental health facility for 72 hours following a hospital visit. Corinne's mental health struggles, including bipolar disorder and suicidal ideation.
Corinne pretty much said if I go home, I'm going to break a glass and slip my neck.
Have put Janelle in a nearly unimaginable position.
There's many mornings I think about, is my kid going to be awake or alive when I wake up?
Even stronger than that fear is her love.
Facilities, especially after the pandemic, are super full.
It's easy to feel stuck when Janelle says so many other children are in the same position as her daughter.
They can pick and choose who they want to take. And if you have somebody who's a level 1 needing help versus a level 10, they probably will take the level 1, you know, and in a sense, I can't blame them, but my kid still needs help.
I think the needs are high, and it's more than the community can handle.
All those emergency visits contribute to a much larger issue. A number of major medical organizations say children's mental health is a national emergency with disproportionate impacts on communities of color.
It's a problem that was actually getting worse steadily over the last decade, and then all of a sudden the pandemic hit.
With the greatest increase because of overdoses and suicidal thoughts over the last 10 years. UW Health has seen a dramatic increase in monthly visits to their children's emergency department related to mental health, with a significant jump since 2020.
It's astonishing. And a lot of the primary care clinics are trying to manage this as well, as are outpatient psychiatrists. And they are so overwhelmed with patients that have these suicidal thoughts that they end up overflowing into the emergency department.
Dr. Allie Hurst says one of the most striking things they've seen is an exponential increase in visits from patients younger than 13. And those numbers show COVID-19 and its isolating effects worsened an existing problem, along with a contributor right at our fingertips.
Social media has definitely been a factor. We're hearing that from kids as well when we're seeing them, that the bullying has increased, social media presence.
Though the mental health emergency is still at a critical point. At Children's Wisconsin, they say they're cautiously optimistic their crisis response team is carving out a path forward, offering a collaborative approach with follow-up care after the visit.
We are starting to see a decrease in the amount of return visits to the emergency department, which I think speaks volumes to the work that we are doing with patients and families.
And while Janelle and Corinne have been to the hospital for mental health concerns multiple times since our interview in early February.
There's just so much. So I feel like a lot of people are falling through the cracks.
This mother says she won't stop fighting to get her creative, funny, sassy daughter to a place in life where she's safe.
I've had multiple caseworkers say to me, "You're so helpful with this. Like, what happens to the kids who don't have moms or dads or grandparents or whoever who advocate a lot for them?"
In Elkhorn, Madeline O'Neill, FOX 6 News.
Data from the CDC shows suicide is the second leading cause of death for children between the ages of 10 and 14. There are many resources available. For example, you can call or text 988 for immediate mental health help. We also have more resources in this story online, including when health professionals say you should choose to take your child to the emergency room. You can find that at fox6now.com.